Hello. In this video, I'm going to give you a series of tips to improve and reduce the discomfort and problems of varicose veins and poor circulation. That heaviness in the legs, so common in the modern world. But first, before anything else, it's important that you understand what varicose veins are and, of course, what causes them. For that, I want to show you this diagram. Here we have a cross-section of a normal vein. This would be a tube, and we have opened it up, seeing the half. This is a tube that would be very long. It would go up here and come from below. Veins carry blood from the periphery, from the tissues, back to the heart. They carry it back, opposite to what arteries do. As you can see, veins have a one-way valve system. Similar to inflatable mattresses, you can put air in, but when you want to let it out, the valve closes. Air can enter, but when it wants to leave, the pressure itself closes the valve. The same thing happens here. Blood goes up, but when the heartbeat is not propelling it and it wants to come down, the valve closes, preventing the descent. As you can see in a varicose vein, this valve starts to fail. The vein begins to dilate. The tissue deteriorates, the valve fails, and the blood starts to flow back, causing a dilation at the lower level, and the entire vein begins to fail in some way. It's a failure of the venous return system, with that characteristic dilation of the vein. Additionally, there is an important factor. Here we see an artery. Here would be the capillary area, where fluids, blood, and nutrients are shared with the tissues, and the fluids return to the vein through venules, becoming a vein. Notice that the thickness, especially of the muscular area, of an artery is much greater than that of a vein. This makes veins more vulnerable to these dilations. However, there are many other factors that can cause these walls to dilate, such as exposure to toxins or high levels of sugar. It is widely known that diabetes causes damage to the vascular system, not only to the capillaries but also to the rest of the circulatory system. And in general, any toxicity will cause damage to the vein walls, promoting this dilation. Factors such as sedentary lifestyle, lack of movement that doesn't allow these veins to receive support from movement to pump blood upwards, will also contribute to their dilation and failure. Furthermore, of course, there is an undoubtedly genetic factor. The nervous system will also have its influence, as well as many others that ultimately lead to the body's failure of the venous system. Once we have a rough understanding of what varicose veins are and what causes them, it will also be easier to understand how we can improve and take care of this problem. First and foremost, engage in gentle and frequent physical activity and incorporate a little exercise into your daily routine. I wouldn't recommend intense or competitive exercise, but rather gentle and prolonged exercise, done regularly. On the other side of the spectrum, avoid a sedentary lifestyle, static positions, and the habit of taking short walks, like 2 steps here and 2 steps there. This causes blood to stagnate and prevents the venous system from effectively returning the blood. Of course, quitting smoking is essential. as it damages the walls of the circulatory system and contributes to the development of varicose veins. Reduce salt and sugar consumption. As mentioned earlier, maintain a diet rich in fruits and vegetables, which will also help with weight reduction. Excess weight is another significant factor in these problems, particularly if there is swelling in the abdomen or pressure in that area, as it hinders venous return. Additionally, use compression stockings. However, in my humble opinion, I would only use them in specific situations or on particularly challenging days. If all your days are challenging because you constantly work on your feet, such as being a cashier in a supermarket, you may need to wear stockings every day. But if you're going for a walk or engaging in an activity that naturally allows your system to function well, give it a chance to do so without external assistance. Wearing compression stockings assumes that the system is failing, and you need to provide support. If you're going to stimulate your system to function on its own, at least for the day or in those situations, try giving it the opportunity to do so naturally, allowing your body and circulatory system to work on their own. You can also help by alternating between hot and cold showers, always ending with cold water. Even if you don't alternate, when you shower in the morning, make sure to finish with a good cold water spray on each leg for a minute. I know it's painful and requires effort, but you'll see how much better it feels. Avoid tight clothing that hinders venous return, such as tight belts or tight garments in the groin area. High heels can also cause the muscles and pelvis to be in a position that hampers venous return. Prevent constipation, as it increases pressure and compresses the inferior vena cava, making it difficult for blood to flow upward and impeding venous return. And, of course, a fundamental piece of advice is to remember herbal medicine. Medicinal plants can be your great ally in caring for, improving, and treating varicose veins in the long term. Here are some examples, such as horse chestnut, butcher's broom, witch hazel, green nettle, cypress, yarrow, or ginkgo biloba. All of which have an effect on the cardiovascular system, improving blood circulation and especially venous return. There are many more, so you can search for the ones available in your country or region. Gather information about them and vary the combinations, using different mixtures of 4 or 5 circulatory herbs, so that your body doesn't receive the same stimulus all the time. If you have had a circulatory problem for a long time and expect to continue dealing with it for many more years, it's good to do this herbal treatment a couple of times a year, always helping your body maintain its well-being. I believe this covers everything I wanted to share about varicose veins. I hope you found this video interesting and that it provided you with tools and a clearer understanding of this problem and how to take care of it. Remember that you can find many other videos with exercises, self-massage techniques, tips, and explanations on this platform, OnSalus Health.